During puberty in females between ages 11 to 16, a menarche occurs. So what is a menarche? It is defined as the first menstrual period in female adolescent wherein the vagina, the uterus, the uterine tubes, and external genitalia begin to enlarge. So here are some of the key terms to remember before jumping right into the menstrual cycle and ovarian cycle. So first, yung menses. It is a period of mild hemorrhage wherein yung functional layer of the endometrium is expelled from the uterus. Next, menstruation. A discharge of the blood and other elements of the endometrium. Next, ovulation, a process in which a mature egg is released from the ovary. And next, luteinization, a process by which elements of the ovarian follicle are provoked by the ovulatory stimulus to develop into the corpus luteum. So the menstrual cycle has two divisions, the ovarian cycle and the uterine cycle. So there are three phases under the ovarian cycle. Ayan yung follicular phase, ovulation, and luteal phase. While sa uterine cycle naman, menses, proliferative phase, and secretory phase. So magpo-focus tayo more sa menstrual cycle, particularly sa ovarian cycle. So kanina, nabanggit na yung about sa menarche, which is the first menstrual period. Ngayon, we will dive into the details of the menstrual cycle. Kung mapapansin natin sa picture, kapag sinabing follicular phase, ang pwedeng palatandaan dyan ay yung egg or the ovum is inside a follicle. So sa luteal phase naman, the egg has exited the ovary, kaya corpus luteum na yung term. So sa follicular phase, nandun yung key stages of development of the follicles. So andyan yung primordial follicles, primary follicles, secondary follicles, and antral or Graafian follicles. So the hormone responsible for initiating the development of the primary follicle is FSH. So ano nga ba yung FSH? FSH is a hormone secreted from the anterior pituitary gland. So dahil nga yung role ni FSH is to initiate, now paano nga ba nagmamature into a larger follicle? So there are three factors. First, the secretion of the estrogen into the follicle. So dahil sa estrogen, there will be a formation of FSH receptors primarily by granulosa cells, resulting in a positive feedback. So second, the combination between the pituitary FSH and estrogens will initiate the LH receptors that will eventually lead to LH stimulation. So the combination between LH and FSH secretion will stimulate follicular growth and maturation and increase in follicular secretion. So third, the combination between the estrogens from the follicle and LH resulting in proliferation of fecal cells. So out of many follicles developed, only one proceeds with ovulation. So this is the mature follicle, which has a diameter of 1 to 1.5 cm. So on the other hand, ovulation occurs 14 days before the end of the menstrual cycle. So because of this luteinizing hormone or the LH, the ovum is released from the follicle to the ovary. But before it happens, dumadaan siya sa process or mechanism. Ayan, presented siya sa screen. So next, the luteal phase, which is considered as the second half of your menstrual cycle. So it starts after ovulation and ends with the first day of our period. So ayan, luteinization, a process by which elements of the ovarian follicle, granulosa, and theca internal cells are provoked by the ovulatory stimulus to develop into the corpus luteum, which has a yellow appearance due to lipid inclusions. So yung corpus luteum is immediately formed after ovulation, and it has the ability to secrete hormones. So these hormones are progesterone and estrogen. So after 2 weeks, the corpus luteum will shrink and turn into a corpus albicans. So yung corpus albicans has no secretory function, so therefore, the progesterone and estrogen levels will eventually drop. And that's the time the menstruation begins. So for this division, here's a little overview of what happens in every phase of the uterine cycle. Other details regarding this cycle will be discussed by the next reporter. So sa menses, the endometrial cells die. The menstrual fluid contains slough cells, secretions, and blood. Sa proliferative phase, epithelial cells multiply and form glands, and the spiral arteries supply the glands. So secretory phase, the endometrium becomes thicker and the endometrial glands secrete.
So next, we are going to talk about the menstrual phase and menopause. First, what is the menstrual phase? It is the first stage of the menstrual cycle. It is also called menses, and it's the shedding of the monthly buildup of the lining of the uterus. Through the little opening in the cervix, menstrual blood and tissue are released from the body through the vagina. Most people get their first period between ages 12 and 14, but for some people, they get them earlier or later than that. Menstruation is the process by which the body prepares for a potential pregnancy. Each menstrual cycle is regulated by ovarian and pituitary hormones, which natural fluctuations can cause various menstrual symptoms. It is the rise and fall of hormones such as estrogen and progesterone which influences the female fertility. In this phase, it typically lasts from day 1 to day 5, and it is the time when no sperm fertilizes the egg. Every month or every menstrual cycle, the body of the woman prepares for pregnancy. Hormones make the eggs in their ovaries mature, and when the egg is mature, it means that it is ready to be fertilized by a sperm cell. These hormones also make the lining of the uterus thick and spongy. And if ovulation takes place and the egg isn't fertilized, it means that there is no pregnancy and the body does not need the thick lining in the uterus. This lining breaks down and the blood, nutrients, and tissue float out from the body through the vagina. So during menstruation, many women does not experience any discomfort while others experience mild symptoms. These are some of the symptoms that some women experience. First is moodiness, trouble sleeping, food cravings, cramps in the lower abdomen and back, bloating, breast tenderness, and acne. Next is menopause. It is the end of a woman's menstrual cycle or when women stop having their monthly period. Menopause is also defined as 1 year without periods, and after this, you can no longer become pregnant. For most people, they stop getting their period when they're between 45 and 55 years old. And menopause can take a few years, and the period usually changes gradually during this time. After menopause is totally complete, you can't get pregnant anymore. Some, however, may experience it at an earlier or later age than the average. At menopause, you stop producing eggs, which means a woman stops ovulating. So as a woman age, the reproductive cycle begins to slow down and prepares to stop. The ovaries makes less hormone called estrogen. And when this decrease occurs, the menstrual cycle starts to change and it became irregular and then stops. There are 3 stages of menopause. First is perimenopause, which describes a time when hormones start to decline and menstrual cycle becomes erratic and irregular. Second is menopause. It is when a person stops producing the hormones that cause menstrual period and have gone without a period for 12 months in a row. And lastly, postmenopause. It is the time after menopause has occurred. Once this happens, you're in postmenopause for the rest of your life. That is all for our report. Thank you so much for listening.